everyone, Dr. First is here. A common interdisciplinary treatment in orthodontics is treating patients with peg-shaped or malformed maxillary lateral incisors. Let's learn how we should manage those cases in this video. If sufficient space exists, a composite restoration may be placed before orthodontics treatment. However, in most situations, there is not sufficient space to restore the malformed lateral incisors. Therefore, orthodontics is often necessary to create space to build up peg-shaped lateral incisors. As a space is created, 4 questions must be answered. First, how much space is required to restore the lateral incisor? This may seem obvious. If the patient has an existing lateral incisor of normal width on the opposite side, it seems logical to create the same amount of space. However, it is advantageous to create extra space. This will allow the restorative dentist to contour and polish the interproximal surface of temporary composite restoration so it matches the width of the opposite lateral. If the patient is congenitally missing the opposite lateral incisor, a diagnostic wax-up should be constructed. This will determine the correct size for the restoration of peg-shaped lateral incisor. During this step, considering the golden ratio is important. When creating a space orthodontically, a second question arises. Where should the maxillary lateral incisor be positioned mesiodistally relative to the central incisor and canine? If the lateral incisor is positioned too close to the canine, the mesial surface of lateral must be over-contoured to achieve the correct width of the lateral incisor restoration. The result of this could be unaesthetic. The emergence profile or contour of mesial surface of lateral and central incisors is relatively flat. The distal surface of central and lateral incisors are more contoured or convex. Therefore, the peg-shaped lateral incisor should be positioned closer to the central incisor than the canine during orthodontic treatment. We ideally prefer to distribute 1/3 of the space mesial to the peg-shaped lateral incisor and 2/3 of the space distal to the peg-shaped lateral incisor. Where should the lateral incisor be positioned buccolingually? Toward the labial, in the center of the ridge, or toward the lingual? The answer to this question depends on the type of permanent restoration that will eventually be constructed for the tooth. In most cases, during orthodontic treatment, a temporary composite buildup is placed on a peg-shaped lateral incisor. However, eventually, this tooth may be restored with either a porcelain laminate or a porcelain crown. If the eventual restoration will be a porcelain crown, the lateral incisor should be positioned in the center of the ridge buccolingually, leaving 0.3 to 0.75 mm of overjet. This will avoid additional tooth preparation on the lingual of lateral and permit space for gold and porcelain in the final restoration. However, if the final restoration will be a porcelain veneer, then the peg-shaped lateral should be positioned lingually to contact the mandibular incisors in centric occlusion. This will allow sufficient space on the labial to construct both temporary composite buildup and the eventual porcelain laminate. Finally, where should the lateral incisor be positioned incisogingivally? This relationship is determined by the position of the gingival margins. Most peg-shaped lateral incisors are not only narrower mesiodistally and buccolingually, they are also shorter than normal lateral incisors incisogingivally. If the incisal edge is aligned with the opposite lateral incisor, the crown may be too short. Therefore, the gingival margin of peg-shaped lateral should be aligned with the contralateral lateral incisor. The restorative dentist will restore proper length, width, and thickness of the tooth when the temporary composite buildup and final restoration are constructed. I hope you find this video helpful, and I do appreciate it if you can support my YouTube channel by your likes, comments, and subscriptions. See you soon with the next video. Bye!